Hi, my name is Nicole and I've had an abortion.
Hi, I'm Shay, and I've had an abortion.
Tonight we're going to talk about House Bill 2354, the Reproductive Health and Access Bill. And I just want to highlight a few things that bill covers. It prevents government from interfering with any woman's ability to decide about birth control or coming to terms with the pregnancy or terminating the pregnancy. It mandates responsible sex education, and it also makes sure that government funded things like Medicaid provides women with basic reproductive health care and services. Would you like to add anything to that, Shay?
Yes, the bill also allows that with the medically accurate sex education, it gives parents the options if they are not comfortable with their children being taught the sex education in schools, that they have the option to pull them out of the classes. It also have like a provider's rights, where it states if a provider is not in agreement with a woman's birth control choices or abortion choices, they have the right to not treat the woman, but instead of refusing them service, they have the option to pass it on to a practitioner that supports the woman's decisions. Now, the bill has 32 co-sponsors currently, the lead co-sponsor being Barbara Flynn Curry. Unfortunately, in the last legislative season, it did not get passed. It was referred to the Rules Committee. So we are working now to keep everyone informed and to drum up support for this bill so that in the next legislative season, it is able to get passed.
Okay. So, I just wanted to say why I feel that this bill is so important. I feel that it is very important because it is a bill that impacts, women like me, women of color, low income women. And I am happy to say that Illinois is very supportive of this bill. Actually, I have a few facts that when it came time for voting, because I'm sorry if I didn't mention that this bill has not been passed. It did not go through. But there were 64% of African American voters. There were 60% of Latinos and 63% of women under 50. 59% of college educated women. Democrats 62%. Chicago voters 61%. And Cook County voters 56%. And then the pro-choice voters 68%. So we had very high rates of people in Illinois that really would have liked this bill to be passed, but we just have to, just push it a little bit more. So why is this bill important to you?
I think it's just very important for a woman to have the right to choose, not just in a pregnant situation, but she should have the right to choose and the access to be able to access birth control. If she's a young woman in college, doesn't have any medical insurance, very low income, I think she should be able to access birth control if she chooses not to bear children. Also, I think children should be taught medically accurate sex education in schools because they are going to become adults, and we all know if you get good sex education, it will prevent unwanted pregnancies, which in turn will decrease abortions. And it also will educate women and boys and young men about birth control, because every form of birth control is not for everyone. But if you have this bill and act, it will give women access to birth control and education about birth control, because everyone can't take the pill. It doesn't work for everyone, and some women get discouraged when they take forms of birth control and it don't work, and they just give up, and then you get the unwanted pregnancies. But if they are I think, educated properly in the schools, and they learn about all forms of sex education, including contraception, it will help prevent unwanted pregnancies.
Well, I heard you say that comprehensive sex ed would be for, girls and boys, and that just boys. That just leads me on to my next question, and I want to ask you, how does this bill affect boys and men? Why is it important for them to be on board with this bill also?
Because we both know in most situations, boys take part in conceiving pregnancies, getting a woman pregnant. So the woman having the availability of services is very important, because that may be something that ultimately he chooses, to support her in. And it's important because boys and men are in women's lives, and it's important for boys to support women and girls. Also, you have the part with the practitioners. Those are sometimes males that are going to, maybe for religious reasons, may not support abortion or birth control. So they are the ones who are going to be affected by the provider rights. Also, boys and men are in schools, so they should also be educated accurately as well. So even though a lot of this directly affects women, men need to support women. What about the men that do support women? What about the doctors that are men? What about the boys in the schools? So even though this highlights women, it also involves men highly, because men are involved in women's lives.
Exactly. I just think that was just a very good point. Because we often have men ask us, what is our part in this? Why should this be important to us? And there you go.
And ultimately, women do have the choice. It is their choice because it is their bodies. Mm-hmm. But again, we encourage men to support women. We really, really encourage men. Go ahead.
So, do you have any questions for me?
I sure do. You want to take the caller? You have a caller?
Oh, go ahead, caller.
This is Paula, Northwest Chicago. I am very, very, very spiritual Christian. My ethics tell me I will not kill a baby in my uterus.
Thank you, caller, for calling us.
So what I was saying would this bill allow Medicaid to pay for abortions? Because now Medicaid doesn't cover abortions.
No, it would not allow Medicaid to pay for abortions. It just covers basic services like prenatal health care, access to birth control, and just access to places and services that provide abortion, but it will not pay for it. That would be the Hyde Amendment that needs to be overturned to make that possible. As you can see, she's wearing the shirt. So that's just a whole nother fight, but it will not cover that.
Okay. I just wanted to get clarity, because I know in the bill it says it gives women a continuum of choices, and that's just basically saying it gives them access to reproductive health services, right. Not give them access to choose abortion, the right to choose abortion if that's what they want to do, but it does not have anything to do with funding.
Right.
Okay. What is the biggest obstacle you think for getting this bill passed?
Well, as you can see, we just had a spiritual religious caller, and I think that is one of the biggest obstacles we face in pushing this bill, because a lot of people can't see past the part of abortion, and we know that, people that are Catholic and that is their religion, they, don't believe in terminating the pregnancy. They don't believe in birth control. They don't believe in responsible sex education. And this issue is really not an issue of